What to expect during your physical therapy evaluation. The start of your rehab journey and the creation of your program starts with our evaluation. So let's get into what to expect during your physical therapy evaluation. The evaluation will be around 90 minutes to 2 hours and has 3 main components that we want to go over. First is hearing your story. Second is the physical assessment. And third is debriefing and game planning your initial rehab program. When we say we want to hear your whole story, we really mean it. When was the last time you had a healthcare provider sit down with you and really listen to everything you had to say? The first 30 to 60 minutes of your visit with us is to learn about your history, your current situation, your past experiences. We want to know what you've tried, what's helped, and what hasn't helped. We want to learn about your lifestyle, your stress level, what you like to do for fun. We want to understand what your goals are, the demands of those goals, whether you want to return to running or you want to return to a strenuous job or high-level physical activity. We need to know these things. Lastly, we want to help answer any questions or concerns you may have and myth bust any claims you may have heard from the internet or other healthcare providers. You'll be surprised how much of your plan is already being constructed just from hearing you tell us your whole story. From here, we'll head out to the gym floor, where we'll take a deep dive into your physical assessment and see how you move. At Reload, we take a full body approach to rehab. So even if you're coming in for a shoulder injury, we're gonna look from feet all the way up, because in the end, it's all connected and everything's related to one another. We'll start by assessing your range of motion, your mobility, your strengths, your weaknesses. We check qualities such as your endurance, tolerance to impact, coordination, power production, and even speed. When every exercise is already on the internet and Dr. Google is just one click away, our job is to figure out the best exercises for your current situation. This leads us to the last part of our evaluation, the debrief and the game plan. Here's where you and your therapist will establish how to best work together. Most physical therapy practices assume that you're gonna come in 2 times a week for the next 10 to 12 weeks. But we truly personalize all of our plans to meet you where you are and meet your needs. If you need more support early on, we may ask that you come in 2 times a week up front. This way you can learn under supervision and build confidence with movement and physical activity again. If you're experienced with training and you need less support but more guidance, then our therapist will try to set it up where you come in once a week to progress your plan and troubleshoot things that come up along the way. Lastly, if you're feeling confident with both your training and quality of execution, your therapist may just want to check in with you every few weeks to make sure you're heading in the right direction. This is a team effort, and as much as we want to honor what you want, we will also always be upfront with you about what you need and what we think is best for you. This way, we have to work together to figure out how to make the most of our time together and always remember to keep the focus on the goal at hand. We look forward to meeting you and getting to know all about you and your goals. We'll see you soon.